Mr. Nurse. Today I'm going to perform a focus health assessment. Are you ready?
Yeah, sure.
Can I proceed? Okay, Harry, I've got some information from Mila and I'm just going to check with you. If there is any mistake, you can just worry me about that, okay?
Okay, fine.
Okay, Harry, your name is Harry. You're
Yeah.
44 years old. You're father of 3 children, 1 son and 2 daughters. And you are working as a high management position in the airport. Is that correct?
Yes.
Okay. Sorry to hear that your father died of heart attack and your mother due to stroke and your uncle had gotten heart surgery due to heart attack. Is that correct?
Yes, it's fine.
Sorry to hear that, Harry.
It's okay.
Okay, Harry. Now just going through your medical report, I knew that you recently visited GP with a chief complaint of flu-like symptoms. Is that correct?
Yes.
And your GP observed that he had gotten high level of blood pressure. Are you aware about that?
Yeah, I usually got that high level.
Okay. Now I'll just proceed to focus on assessment. Before that, let's start. Yeah, I'll just check your vital signs. Is that okay?
Yeah.
Okay, Harry, you can just put this thermometer. Let me check your pulse. Yeah, I'm just checking your blood pressure, okay? Can I take this out? Okay, the temperature is normal. Okay, let me check on this hand still. Okay, thank you. Now let me check your saturation level. Your saturation level is a bit down, so maybe you look a bit pale.
Yeah, I'm sweaty a bit as well.
Yeah, I can see that. Okay, Harry. I would like to ask you some questions regarding your pain level. You are having some pain still?
Yeah, I'm still having a pain.
Okay. Furthermore, I'll just like you to ask some questions regarding your pain, and
Okay.
I'll use the PQRST method, which will help to assess the pain level.
Okay.
So before that, I'll just like to ask some question. Where do you feel your pain?
I feel my pain in the chest and in my shoulders and in my arm.
Okay. Is it increase or decrease by moving or doing anything?
It's in the same level. If I move, I do feel pain. If
Yeah.
I'm in the rest position, I do feel pain. Like it's the same in moving and when I'm at rest, the pain is the same.
It doesn't subside either in pain or moving.
No, when I do any kind of activity, I feel more pain, like in
Okay.
any kind of exercise. So,
And what's the nature of the pain?
it's like sharp, and I feel like squeezing type of pain.
Is your pain radiating to any parts of your body?
Yeah, it's from my posterior shoulder and is now begin to my left arm. So I'm feeling from my shoulder to the arm.
Okay. And on your severity, how do you rate your pain from 0 to 10? Where 0 means no pain and 10 means severe.
I feel 9 out of 10.
Okay. And how long does it last for?
It usually lasts for more than 20 minutes. I still have pain in my arm and in my chest and in my shoulder.
Okay, thank you, Harry. After the inspection, I could find that head temperature is 37, pulse 100 beats per minute, and respiration is 18 beats per minute, and blood pressure is 160 by 100 mm of Hg on right, and 170 by 110 on mm of Hg on his left hand, and his saturation level was 82%, which is low. And using a PQRST method to assess the pain level, Harry's pain is increase on exertion and has the same level either in rest or moving, and he experienced squeezing and squeezing pain, and his pain is radiating from his posterior left posterior shoulder to his left arm, and his rating scale for severity of his pain is 9 out of 10, and it lasts for more than 50 minutes. So Harry, now we'll just move on to the next step. It's percussion. So are you fine with that?
Yeah.
Okay. Sorry, it's a palpation. So I'll just palpate your radial pulses, okay? Thank you. Uh, After the palpation of his radial pulse, I could find it's irregular and his pulse rate is 100 beats per minute. Okay, now Harry, I'll just move on to the auscultation. And now I'll just hear your heart sound. Is that okay?
Okay.
Thank you, Harry. After the auscultation, I could hear a ASPO sound, which is abnormal and is an indicator of coronary heart disease, hypertension, or MI. So finally, Harry, are you comfortable?
Yeah, I'm a bit okay now, but still my pain is going on.
Okay. Now, Harry, I'll just move on to the last process, is percussion, and I'll just tap on your chest, okay? Okay, Harry, that's all for the focus health assessment and reviewing your medical, your ECG and pathological report. It shows that you have an ST elevated segment in lead V3 and V4, and your pathological report shows that you have modulated rest troponin I and T.
Okay.
So it shows that you are more prone to develop MI. So for this, I have got some. For this, I would like to get some management for this. So I will just give you a 300 mg aspirin and GTN through a clinical pathway, which helps to reduce your pain and makes you more comfortable.
Okay.
Thank you, Harry. Thank you for your cooperation and thank you for visiting.
Thank you so much.